And action! Mark had a question about visualization. I'm going to try to explain it in terms of sports. I've talked about the soft science before, or the value of mindfulness practice in my tutorials on mindfulness practice or relaxation practice, but with regards to just visualizing, I think there is great value in it. Whether you're actually just trying to be a better athlete, or you're trying to fight cancer, or you're trying to lower blood pressure, or you're trying to take care of your anxiety or your panic attack, I think there's great opportunity in practicing a visualization or having a visualization practice. And it doesn't cost anything. But you do have to practice it, because if you just try to drop in suddenly when you're fighting the cancer or having the panic attack or having your blood pressure taken to the doc's office, you've already initiated that stress response, and it's hard to bring that down unless you're very good at your practice. So it's important to do this stuff before the event. And sometimes that just means twice a day. But here's what I tried to I'm going to try to explain. When you have a goal that you set, or an idea, whether it's cancer, beating cancer, taking care of blood pressure, being a better athlete, getting a sub 10-second 100-meter dash, you set the idea, and eventually you get to your goal. Sometimes it's a straight shoot, and you're great. But many times it's not a straight shoot, and you'll have to go through these diversions. Diversions will occur. I think the stress response gives you a lot of diversions. That's when the train tracks will shift over. Instead of going straight, train tracks will shift over again. You might end up at your destination and get your goal, but it'll take so much longer of a journey to get there because of these interruptions that occur. So visualization will sometimes get you there faster. So how do we visualize? If you've ever seen a kid that doesn't have anything to do, well, without a iPad, if you've ever seen a kid without anything to do, sometimes you can see a kid pick up a rock or pick up a branch or a leaf and just go to town with regards to his imagination. That's getting the brain to kind of experiment and go down the storytelling or the story building practice. And it's kind of cool, and you probably remember when you were a kid, it's kind of cool to do that, and you feel a sense of reward when you do it. We'll see it or we'll feel it when we go to a movie, because you're taken on a path of this director that wants to give you an idea, give you a goal, and get you there with a lot of emotion. But when you practice it on your own as a kid, it's just as rewarding without having to pay for popcorn or movie ticket. So the problem is, as we get older, we sometimes push down that imaginative process that we have naturally in us because of reality or worrying about bills or other things that come up in life, high blood pressure, having kids, having a mortgage that's going to be inflating soon. So when we have all those things compacted on top of our natural goals, it just makes it harder to stay focused. So when you have this practice of visualization, it can actually get you to goal without having too many interruptions from that stress response. So the idea would be that when you let the mind calm, and you let the mind imagine, or you go through your process of either seeing the cancer melt away, or seeing that 2-point shot sink in from anywhere on the court, or seeing your blood pressure just lower. Visualizing is very important. It will empower some people to get to the destination that they didn't think they can get to. The best way to explain it is to explain it in what would happen if you don't visualize. If you allow this stress response to come up, and I'll just be brief with this, but imagine if you're trying to lower your blood pressure and you're thinking, is my blood pressure going to be high? Is my blood pressure going to be high? You get the arm in the cuff, is my blood pressure going to be high? And obviously you're kind of ramping up and getting anxious, and eventually your blood pressure comes back high because you're so anxious about what happened. Sometimes when I used to be a competitive shooter in Florida, you're in front of a group of other shooters that are trying to beat you. you have this guy with this timer and a loud buzzer being held to your ear, and then you have this course that's in front of you. You know the course. You know how to shoot because you've been practicing it over and over again, but for some reason the jitters take over and you might mess up. And when you're talking about thousandths of a second, it would be the difference between winning and losing. Unless you just have practiced the course over and over again and you've acquired your sight, if you've gone through your trigger pull, you've done everything you're supposed to do, and it's effortless because you don't let any of those other distractions take you off course. You just focus of where you're going to be or where you want to go to, and you get there. So you'll see some people be very good at it. It does take practice. Sometimes it's just as easy as sitting in a quiet place, having an idea about what you want to do. For example, my cancer sufferer. I have a couple of patients that are fighting cancer as we speak, and they're going to do great. But in the case of thinking or being told you will not live from this cancer, or you're already being given a message that, what the heck was that? You're going to have, I fall into a percentage that I will not survive this in 3 months. You have that and a defeatist attitude, and you've probably seen some people go through that where they spiral downhill suddenly. They don't want to eat, they become depressed, the interactions are socially withdrawn, and then infections come up and the cancer takes over and pain is the 24/7. Then you've also seen other people who have just spiraled upward. They visualize the cancer melting away. They visualize white blood cells actually attacking that area in the brain or the area in the pancreas or the tongue that's a cancerous cell. And you visualize these white blood cells trying to defeat the cancer, change back over to normal cells. And I think it's very important. I learned this from Andy Weil at the University of Arizona. In some cases, even with warts, when warts become very difficult to treat, you throw on topicals, you take oral medicines, sometimes visualizing your body getting rid of the wart and or talking to the wart and asking, why are you hanging out? It sounds very infantile, very toddler-like, very grade school-like, but number one, it's not going to cost you anything. You shouldn't be embarrassed to try it, but sometimes it does work, and most of the time it does work. When you kind of visualize that and go down the mind's pathway of success, you'll again get to destination faster. I believe you get to destination faster without all these hiccups. But as science always tells you, medicine is based on outcomes. Outcomes are based on studies, on prescriptions or surgeries and procedures. It's hard to invest $1 million into a study that talks about outcomes of visualization because nobody wants to invest in it. But if you look at ancient healing practices in China or yoga or India or even American Indians, South America, there's always some great value put into visualizing. American Indians used to do it in heated tents. There are some cultures where you actually float on water for a long time and just let the mind go. And again, the outcome is great. Number one, you feel good because I think we're given DNA, we're programmed to have a sense of reward when we let the mind experiment and calm and imagine. And all those hormones that get released are just the total opposite of those hormones that get released during stress or fight or flight. When you're being given a task of talking in front of 1,000 people and you don't know what you're talking about, fight or flight will take over. You'll stutter, you'll forget where you are, you'll start sweating, you'll almost faint sometimes because, and nothing's happened except for your mind racing. So the fight or flight response versus the peace, calm, and love response, that can be beaten, or I should say the fight or flight can be beaten by having something of a visualizing practice. So how do we visualize, or how often to visualize? Well, twice a day I think is important, 5 to 10 minutes. And some people, when you're really good, after about 3 weeks, you'll feel the benefits and you want to do that over and over again. It will help you sleep. It will help you get through the chemotherapy. It will help you sink that basket. It'll help you get to the 100-yard dash. You know, when the 4-minute mile was broken by one individual. I think it was, I don't remember the date. Suddenly, after that, so many other men broke the 4-minute mile. If you look at the 100-yard dash, 100-meter dash, sorry, there's something called a sub-10 group. We try to break the 100 meters in less than 10 seconds. And if you look at the last, since 1963, every time there's one person that breaks 10 seconds, usually there's a whole bunch of other guys that also break 10 seconds because they visualize other men doing the impossible. So and that's not from technique or nutrition or practice. That's just from being empowered to get to goal by watching somebody else do it. Well, and if you can practice your own watch or your own visualization, you too can also break that 10-second. You can break the 4-minute mile. You can kill that cancer. You can lower the blood pressure. You can sink that basket. But that's how powerful the mind is it can do those things. It can give you success to get to goal, but you have to practice it. If you try to enlist the mind as far as a visualization practice, deep into your cancer, deep into that fourth quarter, it's going to be hard to turn off that stress response. If you have a regular practice of visualization, twice a day, 5 to 10 minutes or more, just like my mindfulness suggestions, twice a day, 15 to 20 minutes for 21 days straight, and then some after that, you'll be very good at doing it when time comes. And we all get challenged, no matter what the challenge, whether it is a cancer or just going to the doctor's office and getting that cuff on there and feeling the pumping up of the cuff and hearing that tss, or hearing the Velcro go back on and off. That's irritating. So when the challenges come up, if you're a Navy SEAL at what you do, you'll get through the challenge without a problem. If the challenge comes up and you're just trying to initiate a change or develop a visualization practice, that's going to be a lot tougher. You'll still get to goal. You hopefully will still get to goal. But man, you're going to expend a lot of energy and get frustrated and have to take more time. It'd be a lot easier if you do it this way. So that, in a nutshell, is what I think about visualization. I think it is very important. The only problem that sometimes comes up in medical communities is, who has time to teach visualization? That's what I get from some of my colleagues. But you know, it doesn't cost anything. It's fun. It's a practice that will only empower you to have better success. So why not? Do we need to have randomized controlled trials for meditative practice, mindfulness practice, visualization? No. It doesn't cost anything. There's no downside. There's no side effects. So why not embark on that journey? If you do need somebody to help you, there are some people who teach hypnosis, and I think that's essentially the same thing. You always think of hypnosis as being somebody kind of luring you into this idea of falling asleep and taking off your clothes in front of a million people. I don't think it's that way. I think it's visualization. Somebody just empowering you to a practice of visualizing. So if you can get to that point, if you're an athlete, you've probably done it before if you have a good coach. If you haven't been participating in any sports even from a couple of decades ago, ask somebody to teach you. Sometimes there's a guy, Tony Robbins, I think most people have heard of him, that does teach success and visualizing success. There's also psychologists, counselors who can kind of walk you through that too. Mindfulness practice, I think, will get you there. So if you can't figure it out on your own, well, try to practice on your own, research. But if you can't figure it out, then seek out a coach that might be able to help you. But otherwise, I think it doesn't cost anything. It's easy to do or start. Maintaining, this is a different story, but a good question, Mark. Hopefully this gives you a little bit of guidance as far as why I think visualization is important for all my patients, and maybe you can see the value.